40% of child care centers in this country could close because of financial pressure stemming from the pandemic. That's according to the National Association for the Education of Young Children. Joining us now, author of multiple bills to address this crisis, Vice Chair of the House Democratic Caucus, Congresswoman Katherine Clark of Massachusetts. Thanks very much for being on the show. This is a huge issue that is really paralyzing parents across the country who, those who are able to keep their jobs and work from home, have this sort of impossible task of balancing it all in one place. What is the solution?
Well, you're absolutely right, Mika. Childcare is essential, and it is part of our economic and educational infrastructure. But unfortunately, we have not treated it like that. And now, with this pandemic, the results of that underinvestment are becoming so apparent. And we simply cannot have a healthy economy and make sure that our children are reaching their full opportunity without stabilizing and investing in the child care sector. And we know that what we have is a woman-run sector. 96% of child care providers are women. 40% of those providers are women of color. But they have been chronically underpaid. And the statistic that you just cited is one that should be frightening to everyone, that almost half of our child care centers may not be able to reopen. We have to make the investments that I have called for in the Child Care's Essential Act, the Child Care's Infrastructure Act, that will help stabilize this industry and put them on a course for success. It is vital to reopening our economy.
Congresswoman Clark, good morning. It's Willie Geist. As you know, there's a study now out from the Center for American Progress that shows 4.5 million child care slots could be eliminated with the closure of some of these facilities. That is obviously devastating to families. They don't know where to put their kids, what to do with them. It has follow-on effects, as you've pointed out, on employment, whether or not men and women can go back to work if they don't have a place for their child to go. But as you also know, these days are coming up right around the corner. We've now reached the middle of July. Schools are supposed to open in a month or so, month and a half, depending on where you live. How quickly can you get this money out? And is it frankly too late at this point to get some of these facilities open?
It is never too late to make the investment in our children. But what is rapidly becoming too late is the U.S. Senate and this administration that are turning a blind eye and showing a very high tolerance for pain and suffering of the American people, while they let the HEROES Act that we passed over 2 months ago in the House just collect dust on the Senate floor. And what we need to do is pass the HEROES Act. We need the Senate and my colleagues across the aisle to join us to make these investments for American families. We need to look at this pandemic, which is at the worst point that it has been in, and understand and act on that we cannot have a healthy economy if we don't have healthy people. So we need to make this investment in childcare. We need to have a Secretary of Education who says we are going to open schools safely. Those are not words we've heard from Betsy DeVos. She wants to open schools, but she doesn't want to look at how we are going to protect teachers, families, children. She doesn't want to look at the data around this pandemic. She wants to sweep all of that under the rug and say we are going to open schools, and we frankly don't care what happens to the people involved with education. We have teachers in Texas who are filling out wills and medical proxies because they are so afraid when they are given the choice of a pink slip or go to schools where there hasn't been a plan on how we are going to test, trace, provide protective equipment to keep them safe.
Erin Haynes is with us, and she's got the next question. Erin?
Yes, thank you so much. And we also featured that National Association for Education of Young Children survey in the 19th newsletter that showed that among child care providers of color, half of them say that they expect to close permanently without further public assistance. And so, we're seeing a demand among some women or families looking for maybe nannies with antibodies. I mean, so many women feeling like they're really kind of on their own in navigating what to do with their children. And we know that women are the majority of the workforce and the electorate. I'm wondering, what you think that this means for working mothers and what the government's responsibility is to address this crisis for people who don't understand, why the government has a role to play in helping working women figure out childcare so that they can head back to work safely and not feel like they are alone in figuring this out.
Yeah, childcare is a microcosm of racial justice, of making sure that we have opportunities for women. And we know from all the research that it is women who are impacted when childcare is unaffordable and inaccessible in a disproportionate way. And where we have a workforce that is predominantly women and women of color, we have a crisis in the making that we cannot have true equality for women. We cannot have an economy that includes women unless we make this investment in childcare. And this goes hand in hand with building an inclusive economy. And so these issues are essential to how we meet this moment in our country's history, how we look at racial justice, how we look at equality, and how we make sure that our families are safe and able to access education and childcare for their kids.
Congresswoman Katherine Clark, thank you very, very much for everything. Thanks for being on this morning.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.